Hello, my name is Talia, and together with my colleagues Catalina and Isabella, we are going to present Carnitine Palmitoil transferase deficiency. Carnitine Palmitoil transferase (CPT) deficiency is a very rare condition that causes muscle weakness and other symptoms. It happens because of a problem with one or two enzymes, CPT1 or CPT2. Enzymes are substances in the body that help cause chemical reactions. CPT enzymes help get fatty acids into cells to use for energy. They are especially important for certain cells, such as muscle cells, with CPT deficient cells that rely on fatty acids for energy may start to work poorly. This leads to the symptoms such as muscle weakness and heart or liver problems. CPT deficiency can happen in men, women, and children of all age. There are two main types of CPT deficiencies. CPT1 deficiencies. This type cause problem with the CPT1 enzyme. The CPT1 enzyme helps get fatty acid inside yourself. CPT2 deficiencies. This type cause problem with the CPT2 enzyme. The CPT2 enzyme helps make sure your body can use fatty acids once they are inside in yourself. There are three subtypes of CPT2 deficiencies. One, neopathic for most common. Two, several infantile hepatocardiovascular form. And three, lethal neonatal form. Babies with the lethal neonatal form of CPT2 usually die within the first few weeks to months of life. Babies with the several infantile form may live somewhat longer but likely have heart problems and sudden death. And the myopathic form is milder. Most people with this form have a normal life expectancy. CPT deficiency is caused by an abnormal gene. A problem with the gene might cause the CPT1 or CPT2 enzymes to be missing or not work normally.
The first thing to know is that enzyme acts in the first reaction so that fatty acid enter the mitochondrial matrix. We have in the image the fatty acids outside the cell. Then they enter through a transporter toward the cytoplasm, and at the moment of passing the mitochondrial membrane, we will find this enzyme. This enzyme is important for the fatty acid to enter the mitochondria since it cannot do it alone. First, we have the fatty acid attached to a CoA molecule, and we also have a carnitina. Carnitina palmitoil transferase 1, and also called carnitin acyltransferase 1, will be responsible for binding the fatty acid and carnitina so that the acylcarnitina complex can pass. The CoA molecule will separate from the fatty acid. The acylcarnitina complex enters to the mitochondrial matrix, and carnitina palmitoil transferase 2 is responsible for separating them so that a new molecule of CoA activates the fatty acid and goes to its oxidation, and the carnitina can repeat the process with another fatty acid.
There are some ways to do the diagnosis: in vivo metabolic investigation, in vitro metabolic investigation, and prenatal diagnosis. So, in both LCPT1 and infantile type CPT2 deficient patients, a carefully monitored fasting test showed decline of blood glucose concentration and low plasma ketone volume values. In such patients, long chain of triglyceride loading fails to enhance ketogenesis, while serum ketones significantly increase after administration of medium-chain fatty acids. In most adult-type CPT2 deficient patients, a prolonged fast induces an insufficient or delayed rise in ketone bodies, while serum CK markedly increases. Plasma glucose remains constantly normal in these patients. The accumulation of beta-oxidation intermediates may be detected in cells incubated with a labeled LCFA. Also, tandem mass spectrometry can demonstrate the accumulation of palmitoil carnitine in CPT2 deficient fibroblasts incubated with deuterated linoleum and L-carnitine. To date, there is no report on prenatal diagnosis of LCPT1 deficiency, but CPT2 deficiency was prenatally established by ultrasonography, revealing enlarged echogenic kidneys in one fetus. Let's talk about the symptoms. CPT1 cause hypoglycemia, liver problems such as enlarged liver, nervous system damage from liver problems, coma and sudden death. CPT2 cause hypoglycemia, temporary muscle pain, muscle breakdown, and muscle weakness. And little neonatal form cause a weakened heart, cardiomyopathy, abnormal heart rhythms, facial abnormalities, respiratory problems, abnormalities of the brain and kidneys, muscle weakness,